Welcome to Nursing School Explained. In this video on the maximum dosage calculation for pediatric medications. In this particular example, we're going to go ahead over the very commonly used medication, ibuprofen. So that is an anti-inflammatory or a pain medication. So in our example here, we have an order for ibuprofen 10 milligrams per kilo every 6 to 8 hours as needed for a pain level 4 to 6 out of 10. Available we have in our stock dosage of 100 milligrams per 5 milliliters, and our child weighs 46 pounds. Now what we have to figure out, the question is, what is the maximum dose per day we can give to this patient in milligrams and milliliters? So this is something that you're not going to know on top of your head, which is why you're going to consult your drug reference book, and you find out that the maximum dosage for ibuprofen is 40 milligrams per kilo for 24 hours. And keep in mind that 24 hours and day are the same. It's just that usually in a drug reference, you will see it in 24 hours, and then sometimes your instructor or the problem also on your practice exam or NCLEX exam might refer to as day, but that is the same thing. So now for dimensional analysis, which is my favorite method ever to come up with any kind of medication calculation, because it is bulletproof if you know how to set it up. So let's take a look at this. So first of all, we know that we have to do two calculations here, maximum dose per day in milligrams and milliliters. So let's go ahead and write out what we look for. So we'll start with the milligram per day is the max dose we're looking for. So milligrams per day. So now I'll go ahead and I'll take a look and I'll see what do I have available. Well, I have the max dose given per kilo, so we need to convert that. So 40 milligrams per kilo. And then remember 24 hours is a day. And then we have to have our conversion from kilos to pounds. And then we have to put in our patient weight, so that is 46 pounds. So with dimensional analysis, we'll go ahead and we'll cross cancel our units of measure, and we'll see what we are left with, which is milligrams per day, which is exactly what we're looking for here. And so then if we do the math here, it comes out to 836.36, which in this case we're going to go ahead and round up to 836.4 milligrams per day. Or sometimes your instructor asks you to give it in whole numbers. So in this case, that would be 836. Always make sure that you know the rounding rules for your nursing school and also what NCLEX will require or your test center. And so now we have calculated the milligrams. So now let's move on to milliliters. So the same setup here, milliliters per day is what we're looking for. And so now I need to go back and refer to what's available. So my 5 milliliters goes on top over my 100 milligrams. And then again, I'll go ahead and I'll plug in my safe dose in 40 milligrams per kilo per day. I'll convert my kilos to pounds and plug in the patient weight. Same rule, cross-canceling all the units. I'm left with milliliters per day, which is what I was looking for. And this comes out to 41.81. So that would be 41.8 or 42 milliliters per day. Again, depending on whatever rounding rules that apply. So thanks for watching this video on the max dosage. This is super important in the pediatric population. If this dimensional analysis looks a little bit complicated or you're not exactly following, please make sure that you also check out my other videos where I go over from the very beginning on how to set this up. And like I said, if you know dimensional analysis, you'll be golden with any dosage calculations if you're well versed and you practice it over and over again, and you become proficient and pass any dosage calculation, quiz or test or NCLEX calculation for that matter with flying colors. Thanks for watching and see you soon.